Welcome to day 2 of eHealth 2022. Had we been in person for this year's conference, a number of us may have concluded our first day of the conference yesterday with some food, drink, social connections, maybe even a little dancing. And more than a few would have been a little bleary-eyed this morning. I know we're all looking forward to getting back to this kind of normalcy, but in the meantime, for those who were not obliging themselves last evening, I hope you are all bright-eyed and bushy-tailed and ready to kick off today's event. We first begin today, though, by acknowledging that the lands on which we are hosting this event include the traditional territories of many nations. Acknowledging the land is an Indigenous practice that's been happening for thousands of years. It recognizes and respects the legal and spiritual relationship that Indigenous people have with their territories. And we recognize that the many injustices experienced by the Indigenous peoples of what we now call Canada continue to affect their health and well-being. We respect that Indigenous people have rich cultural and traditional practices that have been known to improve health outcomes, and we invite all attendees to reflect on the territories from where you live as we commit ourselves to gaining knowledge, forging a new culturally safe relationship, and contributing to reconciliation. We respect the continued connections with the past, the present, and the future in our ongoing relationships with Indigenous and other peoples within our communities. Thank you. So we have another great day of programming in store for us. And as there simply isn't enough time to take in all of the sessions, we are happy to let you know that all of these sessions are being recorded and will be available to all eHealth 2022 attendees in our virtual library, which is sponsored by Tegria. Yesterday was a day full of content, connections, and new learning. As I went from session to session, I heard a lot of common themes and some strong areas of interest. Cloud computing was a key topic, and not necessarily for the sake of that technology itself, but for its ability to be used in solving very practical challenges, like enabling reductions in carbon footprints while increasing health system capacity and enabling actionable health system insights. We also heard a lot about the imperative and opportunity for digital health solutions to address health equity challenges and to support broader considerations within population health. A call for continued efforts to support digital literacy, change management, and to address training and workforce education needs were also prominent topics of discussion. Whether thinking about the need for advanced technical skills or the knowledge needed to enable policymakers, leaders, and decision makers, there was consensus and recognition of some gaps left to be filled. As an industry, if we're truly to realize the value and opportunities that can be harnessed through the use of digital solutions, data and analytics, and that result in improved outcomes in health system efficiencies, we may still have a bit of work to do. However, we also heard a lot about the progress that's being made to support seamless care delivery, such as through interoperability initiatives and the broadening adoption of virtual care, remote patient monitoring, and telehealth solutions. Through many of these exemplar initiatives, we heard stories of engagement, collaboration, and we were reassured that Canada is on a good path forward. As we come together collectively to address some of these existing challenges, we also appreciate the simultaneous opportunities that appear on the flip side of that coin. As a digital health community, we are strong, we are innovative, and we know we can leverage our experiences, build upon them, and keep moving forward. I finished my day yesterday feeling the camaraderie of peers, feeling inspired and motivated to keep going, and I can't wait to see what today has in store. So whether you are just joining us today, or if you're returning for day 2, I want to remind you that there are so many ways to feel this inspiration for yourself, to engage and connect in the in-conference platform. And I encourage you to join a discussion in the event feed, meet your colleagues in the networking lounge, chat with exhibitors in the trade show, or reach out to attendees through the directory. And don't forget that the more you click, the more points you earn. And the more points you earn, the better chance you have to win some amazing prizes. There's prizes for leaders, but also some random draws, so make sure you get involved. All right, we're ready to get started with today's program. So please join me in welcoming from Medtronic, Jessica Rudd. Welcome, Jessica.
Thank you so much, Cassie. Really appreciated your opening there. And I'm thrilled to be here today. Medtronic is proud to sponsor Digital Health Canada in its mission to connect, inspire, and empower digital health leaders. And as a global leader in healthcare technology, Medtronic's commitment to innovation is driven by our mission to alleviate pain, restore health, and extend life. This mission guides us and aligns our efforts to the quintuple aim to better serve patients, support providers, and add value for payers through a combination of medical technology, digital health solutions, and purposeful partnerships across the entire ecosystem. Now, while we are best known for our medical technologies, I have the pleasure of leading our new partnerships and solutions team, which has been working side by side in hospitals across Canada to increase access integrate new care pathways, and deliver more inclusive, equitable, and sustainable care. Together, we're making important strides, and this is the result of collaboration with hospital partners and health system stakeholders, and through new partnerships with digital health innovators like Ontario-based Cloud DX. Collaboration is a theme I also heard underscored yesterday in a number of the sessions, and we believe collaboration will be essential to tackle current challenges like the pressure on our precious human health resources or find novel solutions to address our extensive surgical and diagnostic weakness. For over a decade, digital health solutions like remote patient monitoring have been available to people with implantable cardiac devices or insulin pumps, and we saw a sharp uptick of those utilization of those monitoring platforms over the last 2 years. And now similar virtual care solutions are being employed to engage and monitor patients before and after surgery and to help patients manage their complex chronic conditions. We're going to be hearing more about remote patient monitoring this morning and the impact that this important technology has on our system and our patients. So I want to thank you to eHealth team for curating this thoughtful venue for curious, passionate, and committed digital health leaders so that we might come together and have meaningful and actionable dialogue over these 2 days. Now let's harness this momentum of the fine work and collaboration already underway and catalyze the power of digital health to transform healthcare in Canada. So we're going to continue this conversation this morning with bold projects in digital health. Please join me in welcoming to the virtual stage Shiran, Isaacksz from who's the executive lead from UHN Connected Care. Over to you, Shiran.
Thank you, Jessica, and good morning, everyone, and happy eHealth 2022. I'm very lucky to be moderating this session and talking about all things bold. And here with me today is a very, I would say, esteemed set of panelists from across the country, across the continuum, as well as across industry that will help us to talk about bold. We do want to jump into the conversation, and I'm going to have each of the panelists do a larger introduction of themselves as we get into the questions. But I will say is we've got Heather Dyck, who's a patient partner with us, Dr. Carolyn Steele from the Lunenfeld Research Institute at Sinai Health System. We have Megan Hunt, who's the Executive Director for Primary Healthcare and First Nations Health Authority, and Dr. David Jaffray, SVP and Chief Technology Officer for MD Anderson Cancer Center. This panel is going to speak to us about BOLD, what they're working on, some of the challenges we're facing. We've got a bunch of questions. But we also are looking forward to having you ask questions of us and the panel. And I'll look to try and get those questions through the chat through our eHealth team. I want to jump right into it in terms of talking about BOLD and really ask each of our panelists what bold means to them. I know it can mean a lot of different things for a lot of different people. And we wanted to really pick the brains of our panelists around the definition of bold. Each panelist is going to take a few minutes to talk about that, and then we'll jump into a number of questions. I think as part of being patient-centered in all our work, I would love to start with Heather in terms of your definition of bold. Heather, over to you.
Good morning. My name's Heather Dyck. I'm a patient partner with the Saskatchewan Health Authority and Skipper, the Saskatchewan Centre for Patient-Oriented Research. I live in the northeast part of the province, a small rural community, and I come to you from Treaty 6 territory and homeland of the Métis. And I'm thankful that I live here on such a beautiful land. To boldly go where no one's gone before, everyone needs the right equipment, the right tools, and the right team behind them to get there. Next slide, please. When the word bold and virtual care are used in the same sentence, it brings to my mind the need to eliminate barriers now, not in the future, so all residents of Saskatchewan and Canada have equitable, consistent, and culturally safe access to a model of care that is becoming ever more prominent and is here to stay. A health system that utilizes a hybrid model of in-person and virtual care, tailored to the needs of the people, can make the best use of healthcare resources, both in terms of healthcare professionals who are limited in time and location, and healthcare funding. Saskatchewan's not alone in having a population base that is geographically spread out, with limited access to reliable internet and cell phone connections as well. While strides are being made to increase access to rural and remote areas, the progress is slower than ideal when healthcare access is being considered. A person's access to healthcare should not be dependent on geography. Next slide, please. the social determinants of health, the non-medical factors that influence health outcomes and stem from conditions that are outside the control of any individual or any individual population, are what cause many inequities in healthcare in our province, our country, and the world in general. Next slide. So how do we as healthcare influencers, including paid, volunteer, researchers, frontline staff, and decision makers, make positive changes that will directly affect the health outcomes of the population? Well, number one, we make sure that everyone has access to culturally appropriate, safe healthcare. We do this by inviting and including the voices of the marginalized people around us at the decision-making tables with an equal voice. This means that we consciously include the principles of OCAP and the Truth and Reconciliation calls to action in our choices and decisions. Number two, we meet these voices where they're at and truly listen. This doesn't mean a boardroom in a major city. This means in the communities that are rural and remote, or where English is not the language that is spoken and understood best, and make sure that these meetings have interpreters, cultural liaisons, and the resources and time to really find out what matters, and just as importantly, why it matters. Only then should change move forward. And number three, we see that there is more than one way of accomplishing the goal of virtual health access, and tailor the solutions to meet the needs of the people, not try to have the people meet the needs of the program being offered. Next slide, please. Once the barriers to equitable, safe, virtual care are identified, then the solutions can be instituted, and they need to be done quickly, which requires the will of decision makers and the funding to accomplish it. In Saskatchewan, a new publicly funded virtual care platform is being launched this summer. This will connect patients and their healthcare providers via video or phone with no added costs to patients or providers. This is an important first step, but the access to internet, cell phones, language barriers, distrust of government, education inequities, job and food security issues, past harms, social inclusion, and discrimination, to name a few, will have an important role to play in virtual healthcare acceptance and uptake by the general population. By including the voice of a patient partner on this panel discussion, at least a glimpse of the needs of the people can be realized. If what I say causes people to question if the right people are at the right table in the appropriate setting, discussing the right questions to enable all citizens to access virtual healthcare and healthcare in general in an equitable, safe manner, then my job as a patient partner is worthwhile. The most important idea moving forward is communication. Thank you.
Thank you, Heather. I think you've highlighted some amazing.
Discussing the right questions to enable all citizens to access virtual healthcare and healthcare in general in an equitable, safe manner, then my job as a patient partner is worthwhile.
Thanks. I'm hoping everyone can hear me okay now. Thank you, Heather. I think you've highlighted some amazing.
Discussing the right questions to enable all citizens to access virtual healthcare.
Thanks. I'm hoping everyone can hear me okay now. Thank you, Heather. I think you've highlighted some amazing.
Discussing the right to enable all citizens to access virtual healthcare.
Are we okay now? I know we're having a bit of technical difficulty. Thanks. I hope everyone can hear me okay now. Thank you, Heather. I can go ahead? Okay, we'll give this a shot and see if we can keep going. Heather, first of all, thank you for your comments. I think one of the things I wanted to highlight and reiterate is really around the equity and access and meeting people where they're at. I think that's the most important piece. I'm going to move forward now to our next panelist, which is Megan Hunt. Megan, if you want to do an introduction and also tell us about your definition of bold.
Thank you so much. Good morning, everyone. My name is Megan Hunt. I'd like to acknowledge the beautiful and traditional territory of the Lheidli-T'enneh people, the lands in which I am situated today. I am the Executive Director of Primary Care and eHealth with the First Nations Health Authority, and it's truly an honor to be here with you all today. I was very pleased to see the question of what does bold mean to myself, but what does bold mean in terms of the context of the First Nations Health Authority? I think it's really important to understand the degree of time and effort and courage that it's taken to set the stage and the foundation to not only support First Nations with enabling environment to access culturally safe, quality services closer to home through digital technology, but the establishment over many years of the first of its kind First Nations Health Authority in BC. That took 203 First Nations a number of years to engage and connect with one another and come to consensus and approval of the development of the First Nations Health Authority. It was an important step in self-determination and taking ownership and control of our health and wellness services back from Health Canada. It was important to have a meaningful seat at the table with our system partners, locally, provincially, regionally, and federally. The establishment of First Nations Health Authority from an eHealth perspective and an access to more equitable care gave us the opportunity in 2013 to engage in the development and implementation of the First Nations-led telehealth expansion project, which went through an enormous engagement process and assessment process with our communities to help address some of the connectivity challenges and to make sure that we laid the foundation of enabling technology to support our communities, not just at the community level, but also in the hands of our citizens across BC to support a more seamless and barrier-reduced access to services. Importantly, hardwiring our protocols, our culture, our ceremonies, our principles, and our practices across our health system, not just within our own. This easily gave us, through the time of the pandemic, to very quickly and expediently stand up some very important programs that are delivered by, developed by, and operated by the First Nations Health Authority with our 205 communities. We stood up very quickly a pan-provincial EMR to connect, importantly, patient information and access to be able to support a continuum of care meaningfully to our communities that has been very fragmented across our system partners. We implemented the virtual doctor of the day, the substance use and psychiatry program that operates 7 days a week. Many of our communities have very limited access and barriers due to isolation, geography, travel. And so this very quickly gave us the ability to bring in physicians that are First Nations, Indigenous, or work and have experience with First Nations communities, and to be able to deliver a level of care and access that was very timely, culturally safe, supported continuity and integration and navigation across all areas within the healthcare system, as well as being able to link that to our specialized and subspecialty services, creating also a peer-to-peer network to improve retention and recruitment of health services closer to home and on the ground, access to those services, not only for our patients, but also for those providers who are often very isolated and need a lifeline of support for clinical guidance, but also peer-to-peer engagement. We also are now developing and implementing 15 First Nations-led team-based primary care centers that will not only be integrated with our virtual pathways, but integrated across our other system partners so that our programs and our services are meaningful, directed, and prioritized by our First Nations and Indigenous people across the province. So I'll just stop there and say thank you so much and looking forward to the rest of our morning together.
Thank you, Megan. And, just really appreciate the great work that you and the First Nations Health Authority are doing. You talked about laying down the foundation, but also innovating on top of that, while also ensuring being culturally safe and connecting those peer-to-peer networks. It's incredible, the layers of innovation and boldness. And I want to talk more about that as we go, as we talk about the opportunities and challenges you have faced in this work. But as we continue with our panelists, I want to continue to look at the definition of bold. And a person who's no stranger to bold is Dr. David Jaffray, who I had the privilege of working with at University Health Network years ago. David, we'd love to get your definition of bold and some of the work that you're doing.
Thanks, Shiran. It's an absolute pleasure to be here. And it wasn't that long ago we worked together. Maybe in pandemic years, it feels a little longer, but I'm just delighted to be here at eHealth 2022 and participate in this conversation around bold. One thing that we have learned, and I think it's important that we just really remember that we are at the very beginning of how digital technologies can help us realize the health systems that we want. And in many ways, it is completely a frontier space. Many of us have settled into our definitions of success, the profession structure, what our patients or what we think our patients should have. And I think there is a huge frontier. We're just in a few decades into this technology as a civilization, and there is fantastic opportunities to be bold. And I just love the fact that you've opened the question around what is bold. And I've been thinking about that. I mean, I'm a guy who's worked in the technology space. I love fixing little problems. You give me a little problem, I love to fix it. I got a solution all the time. And what I've learned is that's not necessarily the best thing to do. The best thing to do is think about value. Think about real value and step back. That requires you to be bold. It requires you to redefine the problem. So often we have a tendency to go to that thing that's going to give us the instant answer, or someone's got a solution that we can buy. And I think boldness really comes from stepping back and redefining what success is. And I've learned that over the years, and I learned some of it from you, Shiran, actually, in great conversations in terms of how we engage patients and so on and so forth. And what I found interesting around bold, and from the perspective of pursuing value, is it actually forces innovation. It puts a demand on people to think about things differently, as we heard from the first two commenters on bold. It makes us think differently. It's so easy just to solve the problem that was put in front of us, like we did in school many, many times. It's much more bold to sort of step back and say, are we really getting the value? Is this really the problem that we need to solve today? And then if you do that, that just sort of drives and requires and it pushes people to need to innovate, to think differently, to step away from the structures that they're working within, to really step back. And I think that is a huge opportunity moving forward as digital really starts to come to life. And as we get out of these first few sort of early formative decades of digital technologies and think about where we want to go with healthcare. The other thing about bold, I think, is you have to invest in the vision and ideas and the work of others. You have to get them to think. And that's where that challenge on innovation is really powerful. Get others to think differently. Canada has so much opportunity. We fragment the country into provinces and regions, and this is just, we're already small. Why do we do that? Let's get into challenging bigger questions, and that requires a degree of boldness. I mean, one of the efforts I have in the context of cancer at MD Anderson, which has been a fantastic effort on our part, is we're completely rethinking the flow of data in the organization. Moving away from the idea that applications generate data and, hey, we could use that data, to much more of a data-centric paradigm. Thinking about what data do we need? How do we make sure it's at the highest quality? And this is a substantial shift and it requires us to engage leadership, thought leaders, and a big change in culture, which is another part of the communication message that Heather brought early on. So with that, I'll pass it back to you, Shiran, and look forward to further conversation.
Thank you, David. I'm going to stop and reflect on one of your comments around being bold is not chasing, I would say, paraphrasing, not chasing that shiny object, but stepping back and defining value. And I think that's such an important takeaway for all of us. I think I've been guilty of that as well in terms of, getting excited about something, but really stopping to assess the value before jumping ahead. And so thank you for your comments. I think it's a great segue into our next panelist, Dr. Carolyn Steele. I've had the great pleasure of collaborating, working with Carolyn on many things digital, but with the integrated care lens. And Carolyn, I'm looking forward to hearing your definition of bold and what you'd like to share with the audience today.
Great, thanks so much, Shiran. It's such an honor to be on this panel, and I think my conversation will build on the great insights from Heather, Megan, and David before me. So I hold a Canada Research Chair in Implementing Digital Health Innovation, and I get to do this work on Treaty Territory 13, which is traditional land of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and the Haudenosaunee and the Wendat peoples. And as Shiran mentioned, my scientific position is at Sinai Health, and I hold a faculty position at the University of Toronto. So I think about the question of bold as an implementation scientist. And so wondering about what bold moves do we need to make so that digital technologies can help us transform our systems towards the visions that Heather, Megan, and David were sharing with us just now. And how do we address some of the really sticky, wicked problems like aging population and health human resource shortages and burnout, equity challenges, and the increasingly complex care needs of our communities? Now, I also want to level set that when I'm talking about innovation, there are lots of incredible ones out there. I'm going to focus a bit more on information communication technologies. So the systems and devices that allow us to transmit, store, create, and exchange information. And often when we think about those technologies and what the future could hold, we're presented with an image of a highway. And we kind of dream about our day when information can easily flow from one place to another, seamlessly and unencumbered. But there are a couple of problems with that particular vision. And I'm going to focus, there may be more than a couple, but I'm going to focus on one in particular, which I think is most aligned with what a bold vision might be for us going forward. And that's that we often, when we think about that, focus on the road itself, creating faster connections to support current information flows in our system. And I think what Megan, Heather, and David are talking about are actually moving away from that old thinking that where we're just kind of paving the existing dirt roads. But we don't often stop to ask questions about the cars that will drive on the roads, or for us, what kinds of information are going to be moving along them. Where are the cars allowed to go, and who made them, and what do they look like? Are they meaningful, and for who? Are all really crucial questions. And we don't always even question whether we needed to pave that dirt road in the first place. So I'm going to bring in an example of where that can stop innovation and health system transformation from a project that I was fortunate to work on in integrated care. It was a large comparative case study across 3 different jurisdictions led by Dr. Walter Wurgis at the University of Toronto, Dr. Lunenfeld-Tanenebaum at the University of Sherbrooke in Quebec, and Dr. Tim Keneally from the University of Auckland. And we had this large team looking at exemplary models of integrated care, like the people who are leading the field. And I had the opportunity to lead a small team to understand how these models were using technology to advance integrated care. And what we found was that even our most digital forward of those examples still were using kind of their technologies largely to support old ways of working, their business as usual. Now that's a problem when you're trying to actually transform the system, because if you're just putting technology onto old ways of working, we're just kind of doing the old things faster. Even if that old thing is not helping us to be more integrated or person-centered or supportive of our providers and staff. So if we take that integrated care piece as an example about how to do transformation and how we can be bold with our technologies to do that transformation, some of the literature in this space talks about different ways we can get to that shift. So Valentin's model of rainbow model of integrated care suggests to move to integrated care, we need to leverage formative and normative mechanisms. So a formative mechanism is like the activities that we do, the processes that we engage in, the actual day-to-day work. And we often think about technology and how it supports that, the actual daily work of the individuals, of the communities that are advancing towards integrated care. However, it's the normative mechanisms that are kind of equally and critically important. And these are the values, the beliefs, the logics, and the philosophies of individuals, teams, and organizations and systems that drive our behaviors and our choices. And it's there in that somewhat kind of invisible space where that will give us the answers to why the cars are blue and not red, and why they're allowed to go to one place and not another. Because ultimately technologies are, as sociologists like Deborah Lupton and Ruha Benjamin have been showing us in their work, that these are social artifacts, that technologies are shaped by our social and cultural values and beliefs. And just as much as they're shaped by those things, technologies also have the opportunity to shape and drive our values, beliefs, and philosophies, which can help immensely in transformation efforts. Now, this could, of course, be a dangerous prospect, as we've seen with how AI algorithms can normalize and amplify bigotry and racism. But we can also be thoughtful and purposeful about how we build and implement and evaluate digital health tools that can support the kind of meaningful transformation we're looking for. So I think the bold opportunity in front of us is to look at how we can infuse digital health tools put in place with our shared values, beliefs, and ideas that we want to be the foundation of our future health system. And I think the examples from Heather, Megan, and David are all showing us different ways in which we can do that meaningfully. And I'll stop there.
Thank you, Carolyn. And, I was just thinking about your comment around, do we need to pave that road in the first place? What I appreciate about your comments, but also all the panelists is, while being bold and pushing ahead, being present and I would say pragmatic. And I think that balance is something I'm hearing from all the panelists. Just to take a bit of a check here, just checking the chat, lots of notes of appreciation and gratitude to all the panelists for your comments and your insight. What I want to do, our panelists are quite humble as they've talked about some of their work that they've done. That's very transformational. That is helping, large populations and healthcare providers across the system. None of this work is easy. Being bold is not just the words, but the action that they are all taking. A question I have for all the panelists, and again, Heather, maybe I'll start with you, and you did share a little bit about this in your opening remarks. But when you're looking at a bold agenda and a bold project, and it's not being easy, what's holding you back? What's stopping you from really achieving that vision? And again, this question of holding you back is for all the panelists. And Heather, if you don't mind, I'm going to go back to you to start us off.
Is if the people that, sorry, there's stuff going on here. If the people that are the end users can't access the program, that could be technology gaps, it could be geography, it could be cultural appropriateness, user friendliness. The only way to know what the issues are is communicating with the people who are having the issues and communicating frequently and actually trying to solve the problem they are having, not trying to get them to fit in with what you think should happen.
Thank you, Heather. Couldn't agree more. Megan, what's your take on this?
Sure, thank you. I think one of the most important areas that can hold the innovation, the advancement, and the equity back is the ability to leave no one behind. And because there has not been a key focus in ensuring that all First Nations communities have and receive an appropriate level of connectivity, it does leave people behind. And so that's an important factor that many people living outside of rural, isolated and remote communities have and probably will never experience. And so that inequity definitely has a factor in holding back in some areas. I think the other piece that's important to acknowledge is that our systems and our governments were not set up to support First Nations meaningfully involved, sitting at, driving, operating within the system. And so building those relationships and creating that space for First Nations to have a meaningful role, to have an equal role, to drive priorities and to lead, operate, and deliver, definitely has had its challenges, but that needle has been shifted significantly over the last number of years.
Megan, thank you for that. And I know what you're highlighting as what's holding you back is not insignificant. But maybe if I could just stay with you for a second, because I think it's such an important piece. You said there is some hope, though. There is some significant progress. Could you maybe share a little bit about that with the audience? Because I think that's important as we think about what's holding us back, the inequity, some of it very structural in place. Is where are some of the glimmers of hope? Where are the movements that you've seen?
Sure, absolutely. I think establishing key and true partnerships with our regional health authorities, with our Ministry of Health and other ministries, where we have a seat driving strategies that are directly derived from our First Nations communities' priorities. The opportunity to influence, the opportunity to develop standards, criteria, and then receive the funding to then be able to develop and implement alongside with integration with our system partners. And so there's that reciprocal accountability and the ability to also showcase the tremendous wealth of experience, knowledge, and expertise that our Indigenous people across BC and across Canada have. And so not only are First Nations and Indigenous people now very connected to the services that First Nations Health Authority provides, but many of our non-Indigenous people definitely see a significant value in a holistic health approach. And that enabling environment and that innovation has really been able to help create that and lay a more equitable foundation.
Thank you, Megan. And I know for many, many of us who, especially in the last few years, have been pushing for this and seeing the challenges of not having the seat at the table, having that voice. I think what you and Heather highlighted is, I think, so critical for all the work, not just in digital, but across our health system. I want to go to Carolyn next and talk to you about what's holding you back. What are some of the challenges you're seeing?
So I'm going to pivot my answer a little bit because I want to build on what Heather and Megan were just sharing. So I think that foundation of communication and reciprocity is really crucial. And that's kind of your first step, is that shared understanding of what's meaningful and purposeful to the individuals we're working with and trying to serve in our health and social care systems. I think the next step after that is to get ready for being a little bit uncomfortable, because transformation of our system and the way we work requires some level of discomfort. And one of the things I find difficult in our field is that we often look at, usability assessments or assessments of implementation that ask questions like, was this a seamless integration of this system into the way you work? But that assumes that the way you work is working. So we need to maybe think differently about how we assess that implementation process, come back to those conversations, those relationships, and those shared understandings to drive that movement forward and to be ready for the discomfort and the learning and the messiness that comes along with this kind of a transformation.
Thank you, Carolyn. Being uncomfortable is a key piece, and again, something that I'm going to take away as well. Last but not least, David, I think about your portfolio, the organization you work for, lots of levers, lots of opportunity, but also I'm assuming lots of challenges. Love to hear what's holding you back.
Yeah, I think we live in a world with a wealth of data, and we're all very excited about it. And I'm convinced that the flow of data will carve the future of healthcare. Where data is coming from, and it's a lot of it, and we're going to believe we're data driven. But at the same time, we've learned about bias, we've learned about assumptions, we've learned that we don't necessarily have all the data. And a big focus for us is really understanding where that data is coming from. Is it representative? Because if we're not getting data from different parts of the world or different sectors of society, it will not shape the future. And we have to be extremely active in managing the biases and the assumptions and the lack of data. And I think this, moving forward, I think is really critical, because the world will get on with doing data-driven decisions. But if certain constituents and representatives aren't active in that process, we see the challenges of diversity and access to healthcare in Texas, for example. It's remarkable, the variation and the need to address that variation in access, yet we don't have the data to drive it in the same way that the masses of the flow of data from current healthcare are driving another agenda. And so I think a big barrier is that equity and access and representation in digital context. So just resonate with the comments from Heather, Megan, and Carolyn in this regard.
I totally agree with you, David. And, equity and access, it's something that we have all been, I think, advocating for. I think this panel here is advocating and pushing that to be bold, we must consider equity and access. So I do appreciate you all highlighting that for us. I've got about 4 minutes left. I was hoping to try and get to the chat, but before I do, maybe I'll do a rapid round fire with our panel. And just jump to one of the last questions we're thinking about it for this plenary. And it's about granting a wish. If myself or someone out there could grant you a one wish in helping you continue your bold work, what would that wish be? Why don't we do a rapid fire around the table? And Heather, why don't I start again with you?
I guess my one wish would be no barriers, no matter where you live, access to health, no matter who you are, and that adding on the data part, that PREMs and PROMs, patient-reported experience measures, and patient-reported outcome measures are included.
Thank you. Megan, what's your wish?
Sure, thank you. Just building off of Heather's wisdom, absolutely, that no matter who you are, where you live, that you have equitable quality access in person, but also through digital means, that there is an ability to make choices that are patient-centered in terms of health and wellness services. And lastly, I would say that my greatest hope is that no matter what the entry point is, the modality of use to access health and wellness services, that our First Nations and Indigenous people experience culturally safe, meaningful, trusting health and wellness services.
Thank you, Megan. And I'm going to come back to this in a bit, but I'm just blown away when you come into a plenary talking about bold. Sometimes we think we're going to talk about the latest cutting edge technology, and it's humbling and a reinforcement to me around how pragmatic you're all being around the focus on what's needed. And I think this is a great takeaway for the audience around, as they're looking at their agendas and bold, what needs to be considered. Let's continue with the rapid fire. I'm going to go next to Carolyn. What's your one wish?
So I'd like to see, us talk very plainly about where we're going in the future and build processes that allow for the kinds of collaborative, interdisciplinary, community-based conversations that allow us to set that agenda and then iterate it and build technologies and infrastructures that continue to move us in that long-term direction. But critically always coming back to the users and the communities and the people we're trying to serve to ensure it's meaningful and valuable and rests in our kind of shared values and beliefs.
Thank you, Carolyn. David, you're the last one. What's your wish?
It's like Christmas, I guess. I think if we could all, the whole world could realize that we are just at the very beginning of the opportunity that digital technologies can bring us. And we don't have to stick to these rules and structures and historical influences of the future, where we could go. And we could all see this as a frontier, and we could all be bold and have important conversations. I wish that could happen. It is not locked up. It is not the final edits on the future of healthcare. We are just at the very beginning. So if we could all think that way, we'll get some bold ideas, we'll break down some terrible traditions and archetypes and so on, and we'll get to focus on patients and what they need and support from their families.
Thank you, David. I think it's a great way to wrap up. I apologize that we didn't have enough time to get into the chat, but I hope that this conversation continues through the conference, through your work. I'm also looking forward to seeing many of you next time in person when we get back together again next year. I will wrap up by saying, first of all, a thank you to Cassie for the introduction, a thank you to Jessica and Medtronic for sponsoring the plenary, and a big thank you to our panelists. Heather, for your advocacy, for your patient voice. We appreciate having you here. Megan, your advocacy of First Nations and the work that you're doing is so critically important, and looking forward to finding ways to continue to collaborate and support that work ahead. To Carolyn, you keep pushing us in terms of the concepts and ideas that we need to look at from an implementation science perspective. Thank you for that. And David, again, as a thought leader in the system, appreciate that. And I think your comment around, it's 2022 and we are just beginning in terms of being bold. So I'm hoping that's the takeaway from this plenary, is that we are continuing to push. The work is yet to be done. Let's keep moving. Thank you again for your time today. Thank you for allowing us into your homes, into your offices, and listening to what's bold, and hoping that you go boldly into pushing digital health across this country and this continent. Thank you again for your time today. Cassie, back to you.
Well, that was truly an inspiring and engaging panel presentation, and I'm going to jump on the bandwagon and add my own thanks to Shiran, Carolyn, David, Heather, and Megan for the discussion and for challenging us to think boldly when it comes to healthcare. Many of the bold ideas that you shared really resonated, such as the concept for barrier-reduced care, regardless of geography, or thinking about programming that's holistic and meets the needs of people rather than people fitting into the programming, and the need to ensure culturally safe and equitable solutions and inclusive processes. I think the ideas you've all shared will stay with our attendees and will generate some new questions that we should be asking about our business as usual practices, as well as bold ideas that we need to seek value from this frontier that we are embarking upon. I think I speak for all of the attendees when I say to all of you on the panel that I hope your wishes that you shared come true. Thank you again for your time. So it's now time to head back into our block of concurrent sessions, number 9 through 12. You can access these in the agenda section of the platform. And then following that at 12 noon, there's time to keep exploring the booths and following up on meetings with exhibitors at the trade show. So get off and get going, get learning, keep connecting, and we look forward to seeing you again later. Thank you.